need, in need of any technology or innovation or idea. And we see this gap in the middle. We see this collection of possibly brilliant, life-changing ideas, but really stuck in this gap and not able to get to the people who need them. So what I study is how to bridge this gap. And this person right at the cliff on the left here is just like chucking as hard as they can to get their idea to the other side. And a lot of what I argue is we actually need to get ourselves to the other side. We need to connect with people. We need to listen intentionally, as we've been talking about, and really understand what are the needs and how can I create something to address those actual needs. So I'm going to tell you just a little bit about my work first. Most of what I do is build technologies to address health disparities. And I know we're all pretty bombarded with this idea of health disparities lately, but I do want to make very clear that these are preventable. Like, by definition, health disparities are preventable or avoidable differences in the burden of disease or in the opportunities to achieve health. And these are usually experienced by socially disadvantaged populations. And so COVID is the perfect example of this, that has even exacerbated a lot of underlying health disparities, right? We see this disproportionate burden on our Black and Hispanic communities. And what does that mean and why is a lot of what I study and how we can use technologies to address that. I want to make one point, though, that technologies can exacerbate health disparities. They can make these differences and these inequities much worse if people cannot access the technologies that we so brilliantly design. So an example of this is the COVID vaccine that we will hopefully have, who knows when, but soon. So how many of you think that once this vaccine is, finalized and on the market, that everyone will have access to it equally? Show of hands, who thinks that's possible? And I can only see a few faces, but I don't see any hands, which is good, because you're right. This is not going to be easily accessible to everyone. It's not going to be equally accessible. There's no way to make 8 billion doses of a vaccine at the same time. And even if we could, that doesn't mean that everyone would have equal access for a number of reasons, which I won't get into, but I believe you can imagine what those are. So I'm really interested in technologies that do the opposite, that reduce health disparities, that are equally accessible, not just to everyone, but accessible to those who really need them, to really address these issues. So the example I'm going to talk about today is related to cervical cancer prevention tools or cervical cancer diagnostic tools. And the reason why, from a public health perspective, we're so interested in cervical cancer is that it's a really objective marker of disparity. So what I mean by that is that this disease, because it's so preventable, nobody should get it. We have really good ways of preventing it. We have a vaccine. We have really good, effective ways to screen for it. That's your pap smear and your HPV tests that women are typically getting at their gynecologist every year. It's really easily treated, super cheap and easy to treat if you do detect it. So this really is a disease that shouldn't exist. But unfortunately, we do see a huge number of cases and deaths every year. And these are disproportionately concentrated in low and middle income countries, over 90%, in fact. And that other 10%, yes, it's in high income countries, but also concentrated in low income communities, marginalized communities, and medically underserved communities. And the reason being, we estimate that less than 5% of women in these low and middle income countries or lower income settings in high income countries have access to screening. Very, very few. So because of all of these reasons, that is why we call this an objective marker of disparity. Where you see high rates of cervical cancer and mortality from cervical cancer, that is almost synonymous with low income, low opportunity, low access to healthcare. So we know that ideally, we would be able to screen everybody using molecular methods, meaning we're testing for the DNA level of the virus that causes the cancer, which is human papillomavirus, or HPV. And as I mentioned, here in the US, many of us see our gynecologist every year. We get screened periodically. But in many cases around the world, people have never been screened. And we have evidence to show that even if we could screen them once, we could potentially reduce cervical cancer mortality quite a bit. So the World Health Organization has proposed, they have this essential diagnostics list and proposed what the ideal cervical cancer screening test looks like. It would screen for high risk strains of HPV at the DNA level, the molecular level. It would be independent of laboratory infrastructure, meaning no need for electricity or running water or anything like that. And we could do it quickly. It could go from a sample to a result in less than an hour. Given all of that, though, we know we have really severe design constraints as engineers in many of these settings that we want to bring this technology to. There are no or limited infrastructure for laboratories in many of the places that we're trying to target. There's a lack of electricity, there's an absence of trained workers, laboratory workers, or even trained pathologists who are the doctors who look at our pap smears, for example. There's poorly equipped labs. There are issues both in transportation and in storage, really rough conditions. And then there's also high turnaround times. So these tests can take days to get results. And if you have someone who left the clinic at that point and they live an hour away and you can't easily get to them and they don't have a phone, or they're migrant people and you lose track of them, this is what's called being lost to follow-up. So we're unable to follow up with our results. So that in and of itself is a problem, right? So the WHO has another set of guidelines for what we need for this type of diagnostic test. It needs to be affordable, it needs to be accurate, so sensitive and specific. It's got to be user-friendly, meaning easy to use and you can minimally train someone and they'll be able to use it. It's got to be quick. It's got to be equipment-free. You can't rely on electricity or anything like that. And it's got to be deliverable, so portable, easy to carry, easy to transport. So that was the focus of my PhD thesis just a couple years ago in biomedical engineering. So I was focused on developing this platform for rapid diagnostic tests, and I focused on HPV as the model virus. So this was just, and this is not a technical talk, so I won't go into detail, but it was an inexpensive paper-based platform that could work very similarly to a pregnancy test. It gives you a yes or no result. Do you have this virus present in your sample? But it worked at the molecular level. So it was able to isolate the DNA that we were interested in analyzing. I'll show you just really quickly how it works. You would take a sample, introduce it. The DNA would get stuck in that little circle, that sample port you see, and all of the liquid would flow over to the left and into the waste pad. We would do a series of washes just to really clean and isolate the DNA, get rid of the waste, and then we would incubate the DNA with a reaction mix that would amplify it, make lots of copies to detectable levels. And then it worked just like a pregnancy test. 2 lines, yes, you have the virus. 1 line, no, you don't have the virus. And this was just a food coloring demo. So no, there's no virus here. So that's how it worked. Really easy. We tested a whole range of DNA concentrations, and we tested clinical samples, and I'm rushing through this for a reason because this isn't the point of my talk, but we showed that it worked and it checked off all of these boxes for the WHO guidelines, and everyone got really excited. And we started a company. My PhD advisor started the spinoff company, and I was there for a while. And all great news. We thought that this was going to answer a lot of the issues that we were seeing with traditional cervical cancer screening for low-income populations. So I'm gonna fast forward a few years. I was starting my first faculty job at the University of Miami. I was really, I'm from Miami. I was interested in going back home and figuring out how to help surrounding communities that I knew were, there's a lot of Hispanic immigrants in Miami, and my family was an immigrant family, so I wanted to give back to that. And studying cervical cancer, I was really interested in understanding that burden in South Florida. And this is a map of the South Florida region, and it's showing late-stage diagnosis rates of cervical cancer. And the reason we're interested in late-stage diagnosis is because those are the cases that were preventable. Those were the cases that should have been caught early, where something like this screening test would improve outcomes. So the darker the area, the higher the late stage diagnosis percent. And so this dark area that you see here at the bottom, lit up on the map, it's actually called Homestead, and I was really interested to to figure out why rates were so high here. I drove down there, and this is home to a pretty large community of Latinx migrant farm workers, mostly from Central America and Mexico. Some of them are migrants, so they did move around a lot depending on crops, but a lot of them lived there for decades, and they had communities, pretty, really long established communities. And so I thought I knew exactly what was going on. I said, oh, this makes so much sense. This is a low income community. They're migratory, so they're being lost to follow-up, or they're not accessing healthcare, they're not getting screened. That is why they have these high rates of cervical cancer. And I thought, well, this is the perfect place to do field evaluations of this diagnostic test, because this will, according to all my training, address all of these little boxes we need to check and solve all their problems and reduce cervical cancer mortality. So I'm gonna jump to the punchline really quick. I had never been more wrong about anything in my entire career. And the journey that I embarked upon at that point to realize how wrong I was really life-changing for me and really career-changing. And so I'm going to tell you that story, and I hope that, this is one particular example, but I hope that you can identify some semblance of relevance to aspects of your own work. And we'll talk more about some generalizable lessons that I learned along the way at the end. So this is a map of South Florida again, and I didn't even know where to start because I knew nothing about this community. But in my mind, I was like, I speak Spanish and my family were immigrants, so this is gonna be easy. So I went down there and reached out to a local community health clinic. It was clear that I needed to get to know this community. So I went to the clinic, and they told me about other organizations that served the Latinx farm workers, and I went door to door and talked to all these different people. And I got some less than supportive, responses, and a lot of questions like, how do you know that these people are not getting screened because they're low income or migrants? How can you assume that they would be willing to get tested? What do you mean by a lay health worker could do it? Minimally trained worker could run the test. How do you know anyone would be willing to be trained on this? How do you know anyone would run this test? And could you even get people to any sort of clinic or health fair or whatever to be willing to do this? You need to ask these questions first. So without knowing it at the time, I actually began doing community-based participatory research. I didn't know what that was. I'd never heard of it. And I'm going to tell you a little bit about that. But just so you know, as a side note, soon after starting this work, I actually went back to school. I got an MPH and started studying this more formally because as an engineer, I felt like I was totally inequipped to answer some of these questions that were coming my way. And of course, everything is clear in retrospect, but as an engineer, I was perfectly capable of understanding and addressing these concerns. It was all a matter of listening to people and letting them teach me, and intentionally, as we've been talking about, listening, which is basically what community-based participatory research is. So I'll tell you, so you don't have to go back to school and get another degree and figure this out 15 years later. The principles of community-based participatory research are pretty intuitive. It recognizes a particular community as a unit of identity, whatever that may be. It builds on the strengths and resources within that community. So it builds on the culture and the traditions and the relationships within that community, rather than focusing on what are the problems. Okay, what are the health issues? What are the social injustices? What are the inequities? We focus on the strengths. We facilitate collaborative partnerships in all phases of the research. That means that the community has ownership and involvement in every single aspect, not just how we carry out the research and then, communicating the findings, but designing what the research questions are themselves. We integrate knowledge and action for mutual benefit for all partners. So this means, yes, we're doing research to build knowledge, but we're also working for the benefit of this community and with a lens of social justice, towards social justice. CBPR promotes a co-learning and empowering process that attends to social inequities. So the researcher takes on the role of a learner. not the expert, not the leader of the project, not anything like that. Really, I was there to listen. I was there to learn. I learn what the context was, what the barriers were, what the real needs were. And the rest of these I'll kind of just skim. It is a dynamic and really cyclical iterative process. So, you try something, you get their feedback, you try again, you adjust over time iteratively. And then we address health from both positive, as I mentioned, focusing on the positives, focusing on the strengths, but also ecological perspectives. So things need to be context specific. You really need to know what the context is, what is culturally appropriate, with actual meaningful consideration of the history of that community and the social organization of that community, and what are all of the issues that have come far before whatever particular health issue you're trying to address. And then, of course, disseminating all findings of the research to everyone involved, first and foremost, the community. So the way that CVPR works, and just to kind of summarize this, is, we start off assessing the strengths and the dynamics of the community. Using that as a tool, you identify the priorities within that community, what are their needs, and what are the research questions that we collectively want to answer mutually beneficially. Designing the intervention is also part of that partnership with the community, always feeding back and interpreting the findings with the community, and then making sure to disseminate and translate those findings into actionable interventions towards the betterment of the community. So I'll skip over to what we ended up with as the research questions that the community particularly felt were important. And you may notice when I go through these that the technology is nowhere here. That little paper diagnostic chip did not make its way into these initial research questions because that wasn't the priority at the time. We needed to first understand what are the specific needs, what are the specific knowledge gaps, what are the specific barriers of this Spanish-speaking farm worker community in accessing cervical cancer screening to begin with. And what is the role of these lay health workers that I was, proposing? What is their role in this community? Do they exist in this community, or what could be their role in supporting cervical cancer interventions? So I'm going to just summarize some of the big findings because I'm much more interested in our discussion at the end. But these were really important, and as I mentioned, really career changing for me. I showed up at the very first, we had a group discussion with some women in the farm worker community, and I was so naive. Wearing my engineering cap, I showed up with like a backpack full of prototypes because I was like ready to show people this thing, and I had no idea what was ahead of me. We started talking. Well, they started talking. We started listening, and we heard a lot of some expected, but a lot of unexpected things related to what their specific needs were. So one of the big areas that was identified were knowledge gaps. We heard things like, those who seek shall find, and these are translated words. These are not direct quotes. Those who seek shall find cancer. So if you look for cancer in my body, you're going to find it, and I don't want to know. So that's why I don't want to get screened. Or the word mentioning cancer was like mentioning death. So the conversation would immediately shut down and no one wanted to continue. The first thing that comes to mind is death. That stuff referring to the treatment is worse than the cancer. No one even wanted to go down that route. And then I had a woman explain that she knew she would never come get screened for cervical cancer because she knew about the speculum. And she knew that when you insert the speculum into the vagina, you let germs from the air in, and then when you remove the speculum, the germs get trapped inside, and that's how you get cancer. I'll never forget that because from a biomedical perspective, I knew that to be incorrect, but it really shook me because I had trained with some pretty brilliant people all over the world on how to end cervical cancer, but no one was listening to the real concerns of people. This was a really evolved and detailed theory that this community held about cervical cancer, which was actually pretty consistent with their lived experience. The only women who knew they had cervical cancer, it was because they had gone to get checked and they had this speculum encounter. And so a lot of these things aligned with their beliefs and their experiences. And it actually made a lot of sense. Even though from my own perspective, I may not have agreed with that, but I needed to fully embrace that to be able to have any sort of meaningful change in this community. Some other huge things that we learned about were the social cultural barriers. So a lot of mistrust and a lot of fear associated with their immigration status. A lot of these folks were undocumented. A lot of them, most of them, are uninsured. So, the community health workers would tell us they're afraid to ask for help. They're afraid to go to the clinic because they think that ICE will be waiting. There's a lot of mistrust around their legal status. And I had a woman off the record after a focus group come tell me, I will never come get screened with your test because I would rather get cervical cancer than get deported. And that's real, that's real. And that is, as an engineer at the moment, I was like, okay, I don't know how to handle this, but it's like an actual barrier to any sort of solution. And how do we listen and to these very real concerns of very real humans who are at the end of this idea that we have, at the end of this innovative technology that we think is going to save the world. These are real issues. We had people tell us that the reason they would never go get screened was because their husbands wouldn't let them. A pelvic exam involves removing your pants, and that wasn't acceptable in many of these cultural settings. So a lot of the community health workers couldn't even speak to the women directly. They had to speak to their husbands first and get their permission. And then even women who weren't married or whose husbands were, not aligned with this, were themselves embarrassed to go get checked. So all of these things combined, getting a woman to go to a clinic to get screened was going to be impossible, regardless of income status, regardless of migration status. We did learn a lot of strengths and positive aspects of this community. So we learned that they did have community health workers. These were really outspoken and nosy women. They were all women. That's why I say women. A community health worker doesn't have to be a woman, but these happen to be. They were in everybody's business. Everybody knew them. They did everybody's hair. They took care of everybody's kids. And they were kind of the trusted sources of knowledge. So, back in 2010, with the Affordable Care Act, there was a call for patient navigation services. So there was budget for that in the Affordable Care Act. So a lot of community health clinics hired community health workers. They went out into these communities and recruited these types of outspoken leaders. And that funding, as we all know, ended. So that's another story for another day. But at the time, there were still some of these community health workers who had been doing this for a number of years. And became the trusted sources of knowledge, of health education, and they were sort of the go-to people. It was not just about health. So you can see from some of these quotes, they helped people pay their light bills or figure out what they needed to do to get their kids vaccinated for schools or find backpacks. They really shared their knowledge with the community, even if it was outside of the scope of their job. So that was such a strength and such a positive asset that we had. It became this really instrumental part of any intervention that we designed thereafter. And so their role in this community was really to let them know who they could trust, assuage their fears, create connections between the community and the health system. And people really listened to them because they knew they could trust them. Technology and maybe re-engineer this technology in a way that circumvents and addresses all of these key sociocultural access barriers that are currently impeding cervical cancer screening. So I do want to save time for discussion, so I'm going to fast forward through all of the different iterations, and this is what we've ended up with right now. And this is ongoing work, which is currently on pause because this is in Miami and COVID has taken over. But what we ended up with in terms of a CBPR informed intervention, as you noticed, the test is just one small part of that. One thing we learned was that a community health worker was really key to any intervention, right? As that trusted source of knowledge was so, so important. So we equip the community health worker with tools, and we consider this engineered innovation just a tool in her arsenal. So we also equipped her with a self-sampler, because we knew these women weren't going to come get checked. They weren't going to come to the clinic. They weren't going to be aligned with getting, a speculum inserted. So a self-sampler actually enables the community health worker to deliver it to their home. The woman goes into the comfort of her own bathroom, takes the test, and then gives it back to the community health worker. And then the community health worker can run this test right there in this woman's home. And while the test is running, because it takes about 20 minutes, she delivers a really comprehensive educational intervention, not just around what is cervical cancer and why are we doing this test, but around what is disease prevention to begin with, because that is also not aligned with their beliefs and lived experience. The idea of going to a doctor when you're not sick, just to see if you're sick, is so not aligned with their traditional experience and their traditional day-to-day lives. So that part of the educational intervention is really key, just describing this idea of prevention. So the community health worker, again, is really key to that. And all of this is part of a much larger, again, comprehensive intervention where we're addressing all of these social cultural needs. Part of what we're doing now is also introducing the idea of the vaccine, get your kids vaccinated for HPV, et cetera, et cetera. So I want to take a little bit of time to try to generalize this one particular example to what I consider technological innovation in general, or engineering in general. One of the things that I think is really important when we're designing new technologies or new ideas, if we want these to be successfully taken up and adopted by people and to really make it across that translational gap, that implementation gap, the first thing that needs to happen is a really real and meaningful understanding of what is the need within a very specific context, real consideration of the historical, the social, the cultural, the economic, the political context of where this need is being met. The second, I think, is really thoughtful and tailored introduction of whatever that technology or innovation is. And this looks really different in different contexts, but this can be a really thorough educational intervention. This could be a service delivery intervention like community health workers or telehealth or social media campaigns, or this is really relevant to, it's really specific to a context and to whatever it is that the technology is working towards. The third is this idea of sustainability or reliability for normalization. And I won't talk about this too much, but when the pregnancy test first came out years and years ago, there was a lot of hesitancy as to why something like that would be useful. Like, why would I need this to tell me if I'm pregnant? The doctor tells me if I'm pregnant. And even if this test tells me that I'm pregnant, I still have to go to the doctor. So what's the point? And as we all know, that has evolved a lot over time. And now there are pregnancy tests in every corner pharmacy and even vending machines around the world. And it has become normalized. Same thing with, blood glucose monitors and things like that. So how do we, sustain these ideas and make them that reliable and that normalized that they just become, part of a given, a common knowledge, and we take it for granted. And one thing that I wanted to mention before I get to the discussion piece is one thing that CBPR is not. I have given this talk in the past, and then I have people contact me afterward and they say, cool, I have this really awesome idea for like this infrared thing that you just pull up to your breast and it tells you if you have breast cancer. And I think every woman needs to have this in their bathroom just next to their toothbrush. And how can we make that happen? CBPR is not a way to get people to use what you make. I think that as engineers, we I think a valid question has always been, how can I design or improve an existing technology to get people to use it, for it to be applicable? But I think a better question that we need to start asking ourselves as a field, as the makers of technology and innovation, what is the actual specific need that I aim to address? And how can I design or adapt technology to best meet that need? And I think that the bottom line to this is that we need to listen, which kind of goes back to everything we've been talking about in this retreat so far. I've worked in engineering in this idea of human-centered design or user-focused design. I've worked with clinicians who talk about patient-centered outcomes and patient-centered research. And I've worked now in public health, where we talk about community-based participatory research. And at the center of all of this, when I look around across all these different fields, we're all saying the exact same thing, just using different fancy words, which is to listen to people. Listen because they are much more aware of what they need and how to address those needs than we can. So in the breakout right before this, we were talking about social injustice and COVID and the intersection of these. And some of these problems seem so insurmountable and we feel helpless. And I think that bringing people who are most affected by these issues into the ideation of solutions is the only way to create meaningful change. And I will give just some examples of that, but I was asked by Dean Wosu to think about practical takeaways for both mentors and mentees. And so this is a little bit of homework, and I don't know if we have time for that much discussion, because I do want to leave time for questions, but I think that the first really important thing as engineers and as students in engineering to apply this framework of cultural competence to your work relies in this idea of understanding who your work is for, who your work might be for. And it's whatever you're working on, really. It can be a cervical cancer screening test. It can be controlled release polymer systems. It can be computational modeling for a particular disease. It can be air quality systems, electrical engineering for energy and climate change solutions. Whatever it may be, understand who would use this, who would this benefit. And for mentors on listening in, we usually have a pretty clear idea of this because we have to provide rationale in our grant proposals. So we know we can imagine the bigger picture of our work. I think it's important to make sure our mentees know this, can answer this question: who is this work for? And mentees, I think that you need to make sure that you can answer this question and hold your own mentors accountable to providing this bigger picture, because I think it's so easy to get caught up in the nitty-gritty details of your thesis and your experiments and whatever it is that you're working on, that you forget to ask yourself this question. And I think this is one of the biggest challenges for students that I work with, and that I think impedes a lot of students from either staying in PhD programs or making progress. How do we motivate students to understand the bigger context of what their work fits into, and to keep you motivated when it's been a year and you've worked on the same enzyme for the same assay, trying to get it to detect a little bit more of your virus? That was my case. What is the bigger picture? How do these things fit into the people who will actually benefit or use these technologies? So the homework assignment for that, number one, is to think of three types of people, what we call stakeholders, anyone who would have a stake in your work, whether that's providers and clinicians or patients themselves, or manufacturers who would benefit from your processes, or public housing, environmental monitors, people who live in public housing and suffer from poor air quality. The list is almost infinite, but who at the end of the road, when this thing is said and done, would benefit from this or would use this? And identify three people or three types of people and call them up. So that's number two. Talk to people. Talk to people who would somehow use what you're working on, would somehow benefit from what you're working on. If you can't think of anyone, ask your mentors to help you. I think that in any space in engineering, we're creating something. We're making a thing that someone's going to use at the end of the day. So it should be totally reasonable to be able to come up with 3 of those people and call them up and talk to them, and then listen really intentionally and listen really compassionately and put yourself in their shoes and understand their experience and how you might learn from that, and improve upon your own work and make it much more applicable. And for mentors, this is usually the point where mentors tune out, but I want to just share a little anecdote that I really like to tell because it's, I think, of interest to those leading larger research programs. In one of the focus groups that when I was first learning about, focus groups and how to listen to people and how to interview and all this stuff, I had a mentor in Miami who worked in cervical cancer in a Haitian population in Miami, this area called Little Haiti. And there were really, really high rates of cervical cancer there too. And so we were in a focus group just talking about this. And one of the women in the focus group said, and this was kind of an awkward moment and maybe TMI to share with you, but I think it's important, so I will. We're in this focus group and this woman says, I don't understand why Haitian women have high cervical cancer rates because we have really clean vaginas. And everyone just kind of stood back and was silent and didn't really know what to say. So we're like, okay, we kind of moved on. And my mentor and I were talking about it afterward. And she said, I wonder what she meant by that. We should follow up and ask her. And we did. We had a follow-up interview and we asked this person, when you said that, what did you mean? And she explained that in traditional Haitian cultural practices, there are intravaginal cleansing routines almost daily that many, many women follow, at least in this community in Little Haiti, which is the largest enclave of Haitian immigrants in the US. So they follow these intravaginal cleansing or douching practices. And that's what she meant by that. They had extremely clean vaginas, so why would they have cervical cancer at these high rates? And so we sent out community health workers to stand, outside little corner stores and just ask 2 quick questions to the women. One was, do you practice intravaginal cleansing? And if you do, what do you use? What are the traditional, because it was all based on traditional plants and herbs that they would do the washes with. So I'm digressing, but after about 100 of these little rapid surveys, we looked at the data, and it turned out that upwards of like 95% of these women were actually, practicing these intravaginal cleansing rituals, and that there were a pretty long list of plants and herbs that they used, but there were about 3 or 4 that were like the most common. So my mentor actually started a partnership with the botanical gardens in South Florida and sourced some of these plants and herbs. And long story short, they started a small, very pilot study exposing epithelial cells to these different plants and herbs. And it turned out that one of these plants in particular was causing the epithelial cells to be much more susceptible to viral infection. And those that were more susceptible to viral infection, there were much more prominence for cervical, for cancerous, precancerous lesions, sorry. So this was kind of mind-blowing, actually. And it started what is now a multi-million-dollar NIH-funded study on the vaginal microbiome and sociocultural practices on intravaginal health. So I really like that story because it really did start with just listening to one offhand comment in a focus group, and it just blew up into this humongous research program that is creating really meaningful work right now down there. So takeaway from that is to listen intentionally, listen to stakeholders, but listen to each other, right? Your students are going to be the ones out in the field doing this work, or in the lab doing this work, or the ones calling up the stakeholders to listen. So if there is something interesting in the things you're hearing from the end users of your work, listen intentionally and bring that back, and think creatively how to incorporate all of these aspects into your work. And I again, retrospect is always clearer. I realized that I had these skills all along. I don't regret going back to school, but I do think that it actually wasn't really that necessary, because there was nothing that I learned from school that led to any more meaningful, um, intervention design. What led to the meaningful intervention design, I can take very little credit for, because it came from the community. It really, some of the best ideas that we're implementing today have come from the women themselves and from the community health workers themselves. So I've rambled for a bit. I'm gonna just take this opportunity to take any questions and to engage a little bit more in discussion. But thank you so much, and I'm happy to answer any questions you may have.
Thank you so much, Natalia. That is fascinating stories and parallel a lot of what we're interested in teaching students. And I know, of course, that I teach with Dean Wusu, but also I think ideas that we want to implement into our curriculum coming forward. And Dean Martin has just joined us, fortunately, and hopefully he'll be able to speak a little bit to that today. But there has been a number of questions in the chat, and I want to start with Kristen, if you wouldn't mind unmuting yourself and at least laying the framework for some questions that are to follow, because I think there was some interesting discussion on the chat that related to your first question.
Sure. Hi, Natalia. I'm Kristen. Thanks so much for your talk today. Really interesting. I was curious about the CBPR method that you presented, and whether or not that would have a place or an application, even if your aim maybe isn't related to social justice. So in my specific example, I was thinking I do a lot of energy efficiency in buildings work, and I'd like to try to take the CBPR method to engage small commercial buildings in that work. Typically larger commercial buildings do a lot of energy efficiency, but smaller ones don't. And so with your experience with the research method, can you share if you think that that would be effective?
Absolutely, and this has come up a lot here at Purdue, not so much in this particular example, but here there's a lot of agriculture work and not related to health at all. And people have asked me, is this like health specific or is this social justice specific? And I don't think that's true. That's a framework that has been effective, but really it's about finding the right people to engage. This kind of question that I posed as homework: who has a stake in your work, right? It could be the people who live in these buildings or work in these buildings, or the people then who own these buildings, the people, I mean, and I'm speculating because I don't know the details of your work, but who is involved and in any way influenced by your work, and is it worth a conversation to bring them to the table to inform anything that you might be working on or the questions that you're asking? And I think that the answer is almost always yes. It's worth that, at least having that conversation. It may not necessarily, necessitate this more involved and in-depth study, but especially as engineers, in anything that we do, understanding who's affected by it and who is influencing that, in general, just increases the success of and the applicability of anything that we're doing. So yeah, I think the answer is yes. And there may be really good examples that I'm just not aware of in the context of your work, but it is worth checking, I think.
Thank you.
Mm-hmm. And I'm skimming through the chat, but I am not as gifted at this as Michael. So I don't know if could you discuss partnerships that we engineers might consider developing prior to engaging with the community group? So yeah, I think that it's actually a really good question, because engaging with a community is actually really hard initially, because like, why would they let you in, and why would they trust you, and why would they engage in meaningful conversation with you? So what in my situation, and what I think many of my colleagues in this space would say, is you need to find the gatekeepers to those communities. And those are usually community-based organizations. The organizations either providing services or advocating for this group. So I started out with, I approached a community health clinic because I thought that was an obvious place to test a diagnostic, but it turns out that none of these people were really going to the clinic. So that wasn't a meaningful partnership to begin with. But they did tell me about other organizations. One of them was the Florida Farm Workers Association. And it was just, a place where they all got together and got to know each other and advocated for issues and helped each other, find resources. And another big organization was called We Count, that helped provide legal services for immigration issues. And so everyone really relied on that and really trusted that organization. So that ended up being a really critical partnership. And they had never worked in the health space. And so they didn't know if this was something that they could help me with, but they ended up being the strongest partner in everything because they were truly the gatekeepers to that community. If we held a focus group at We Count, people would come. If we held it anywhere else, they would not come. So yes, I think that the partnerships are really key, necessary before engaging a community. And it really depends on the community who those organizations are. But honestly, like a lot of those I found on Google, just like South Florida Homestead Farm Workers. And I saw just a couple of organizations, and it was a matter of showing up and knocking on doors or calling a lot. I think once the motivation is expressed and people realize that you are trying to help, then it becomes much easier, and then there's a trust building process. But yeah, those organizational partnerships are really key.
So Natalia, I'm sorry, I left you hanging there because I had myself muted and I was trying to moderate, and I was like, why is this not happening? So anyway, I wanted Jeff maybe to chime in relation to Kristen's question, and there was some shared perspectives, I think, from Jeff, and then Jorge and Sanji, that I was curious if those three might be able to communicate some of their thoughts on related to Kristen's question.
Sure. First, I'd like to say this is brilliant work, brilliant systems engineering, brilliant public health work. I just love it. Having my family's from Appalachia, and it's different but similar superstitions and toughness. My mom was Douglas MacArthur tough. She walked on a fractured leg for 2 days before she went to the hospital twice. And it's hard to overcome, attitudes like that. You just kind of go until you drop. But yeah, I really saw the parallels with customer discovery, which is sort of part of lean startup, which is a method that's kind of taking over. We know that 90% of businesses fail, not because it's not a great idea, but it's because no one wants the product. And I think the poster child is the Segway. And there are quotes from a lot of famous people saying this is going to change the world. And of course, they just finally closed shop for good just recently. And so it's about talking to people. I can't emphasize that enough. That was one of your main driving points. And you had so many surprises in there. The misconceptions about this, getting a diagnostic creates disease rather than helps prevent disease, finding the barriers. Husbands are barriers to care. And I saw different but very similar types of surprises in customer discovery that's related to a startup that I'm involved in. Just trying to understand. The hardest part, I think, is finding those stakeholders you don't know about, and you did that. You found the husbands, and you realize that's a barrier. Yeah. So I'm not sure I can add much more.
It's a really great point, because your stakeholders will lead to more stakeholders. So I have my students, and I think that engineering students are becoming a little bit more aware of these ideas and much more interested in them now than before. And so this is evolving, and we're trying to think at Purdue about ways to integrate stakeholder engagement as a requirement for at least for biomedical engineering students. But one thing I have all my students do is this calling 3 people thing. because some people don't realize stakeholder engagement doesn't have to be this months, years long studies. It can really be a couple of phone calls and maybe an interview or two. But those stakeholders that you contact will lead you to other stakeholders. And so I agree. When we started off, we just spoke to the women and the community health workers. I didn't even think to talk to men. They don't have cervixes. Why do they care? But we ended up towards the end having to really try our best to organize male focus groups and involve male partners in this conversation. And we learned so much more from them about how to address these barriers than we ever expected to. So yeah, I think even if you're not sure where to start, if you and your mentee or mentees, if you and your mentor can think of one stakeholder group to reach out to, that will lead to more. And I think that's when you start getting, I have stakeholder maps and things where I'm like, okay, these are the people that really, really care about their opinions, but they led me to these others, and how are their perceptions connected? And I think that just, it's part of systems thinking, and it's part of human-centered design, but it really does create pretty meaningful interventions and solutions.
I did have one more quick thought, and that's that, as engineers, well, I shouldn't speak for everyone, for myself, it's not always easy to get on the phone and call a stranger, but I made myself do it, and it was just a remarkable experience. I didn't realize a CEO will sit down and talk to you for 30 minutes. It's crazy, the people who are willing to help.
Yeah, agreed. Same with my students too. They're now speaking to, executive directors of like global NGOs that do cervical cancer screening. And when there's an idea there, people want to talk to you about it, and people actually really like talking about their own experiences quite a bit. So yeah, I think it's a lot easier than engineers may think.
So did I hear somebody? I was just wondering if, so in the interest of time, I do want to cover some other questions, and I knew I was going to go to Jorge and then Sanji, but it seems like there was some conversation between them in the chat that, hopefully can continue. But I wanted to go to Sarah's question really quickly, which is, how did you learn how to communicate with people who didn't believe you regarding your expertise on cervical cancer? Did you have some conversations that went wrong in the beginning? Did they get better as you established yourself as a participatory member of the community?
That's a great question, and this may come as a surprise, but I don't consider myself a participatory member of the community, especially as I try to scale up this work and try to engage multiple communities. I'm sure it's possible, but as an academic who has to do lots of other things too and has very limited time to be in the field, I can't be a participatory member of every community that I work with. So I rely really heavily on community health workers, which is why I brought them up, because having people who are members of the community engaged in the work and feeling ownership over the work and able to then communicate and communicate in both directions with the community is really key. And did I have conversations that went wrong? Yes, many. And actually I learned the hard way. I don't even think I have time to even give you the big ones, but one of the things that I learned was as a researcher, and I said this in the list of principles of CBPR, and I like preach about it in my classes, but this idea of co-learning, this idea of being a learner and yes, I'm the researcher, but I am not the expert here. I am not the leader of this project. I am really learning. That was hard initially because it took a lot of negotiation and compromise on my end, because I had answers that I wanted to impart. I had knowledge I wanted to impart, and that doesn't let you sit in a position of a listener or a learner if you just constantly want to impart knowledge and share your own your own experience and where you're coming from. So one example is actually that I learned with my mentor, this idea of the vaginal washing. I said, well, are you going to go tell them to stop? Like, are you going to go tell them that this is what's causing cancer? Like, what's the next step here? And she was like, no, we have to take like 30 million steps back and understand this practice, understand the history of it, where did it come from? And I unfortunately don't have time to go into that, but it was fascinating anthropological work that has gone into this practice of douching in Haitian culture, and the role of men in that expectation. And anyway, I don't have time for that. One other big one was this woman that I shared the story about the speculum, about how I knew that was incorrect. That's not what causes cancer, germs from the air getting trapped inside. And my instinct was to say, oh no, that's not how that works. And I had, my collaborator who had done a lot of ethnographic work kind of elbow me in the side and say, shut up, like, you're here to listen. You're not here to teach people. And I realized afterward, I had a lot of issues with that, because like, I know that that's wrong, and I know that I can educate, and I'm a teacher, right? So how do I like reconcile that? And at the end I realized, like, why would they believe me? Why would they trust what I'm saying? Who am I to come in here and impart my own perceptions, and Western biomedical perceptions? Even if I think I'm right, and even if I think that I could help, how would that knowledge be effective here? And I think that has taken a lot of like self-reflection to get to that place where I can really just listen and not jump in to correct people or to educate. But I did make a lot of mistakes in the beginning, and anyway, having really good partnerships with people who do understand the community is key, because I think it's awesome to aspire to become a participatory member of the community, but I do think that is impossible for my line of work. And anyway, but yes, that's a great question. Sorry, I keep rambling because these are really insightful.
So we're gonna end it with this one. But Brittany, I think, messaged me and said she had a comment that she'd like to share. So we're gonna give the final word to Brittany, and then I'll ask Natalia if you could just stick around and maybe go through the chat and answer some of the questions just through the chat that we weren't able to address.
Yeah, and please, I'll leave my email in the chat. Please email me too. I do have to run in a couple of minutes, but I would love to chat with all of you. But anyway, go ahead, Brittany, sorry.
No, it's okay. I just wanted to let you know that, well, actually what you're talking about in terms of incorporating, that whole, like, you have to survey people and actually figure out what is the need from people versus going through it through the engineering perspective. That was actually the whole encompass of my undergraduate degree at engineering leadership in University of Texas at El Paso. And what you were talking about of like incorporating that into engineering degrees, that's exactly what we did. So like, we would never be able to design anything until we surveyed people first, and then we were having to go through that process of seeing like what their pains were, what their needs were, who the stakeholders were, and then finally go through that engineering design process instead.
That's awesome.
So I would totally recommend, I can talk to you more after and like recommend that you could look at that degree a little bit further and see how they did it, because I can explain it because I've been through it, but I mean
no, and it's that's rare and unique and really, really cool, and something that I would love to learn more about and replicate at Purdue. We do not do that at Purdue, and I still have students tell me I don't know why I have to talk to people. That's not what I'm here for. So yeah, thank you. And can you maybe write the program name in the chat, because I'd love to look into that too.
I think I already sent you
okay.
Something in the chat.
I'm not at the chat, but I will go through all of this now.
Okay.
So Natalia, I think Senji just said it best in the chat is we've really lost the ability to listen, and I think that's very true in our work, but also very true in society in general. And so I appreciate you educating us on the value in terms of the ability to listen and implementing that in a professional way. And I think the work is incredibly powerful and a good lesson for all of us. And we're going to turn it over here to the dean in a second, but he on his Juneteenth message talked about the importance of including cultural competency into our curriculum. And so, you know, I think this is a preview of what we're going to be talking about much more in the future within our school. And we're also talking about merging, at least from a structural standpoint, the buildings of engineering and our graduate school of public health. So hopefully that will create some relationships where engineers can start to work with our colleagues in public health to better explore how we can implement this kind of stuff in our work. So we appreciate you educating us, and thank you for spending some time with us today. And we'll follow your work closely moving forward, and hopefully we can connect again in the near future.
Thank you, Steve.
Yeah, let me just add a word of appreciation to you, Natalia, for a great job. We lead Peace Thrive by listening communication, and you were introduced to us by Jorge, and so we listened to him. And so Jorge, thank you so much for bringing a very great speaker to us, and we appreciate you. You were exactly what he said you were going to be, and so actually more than that, you added a lot of nuances to the things that we want to do for the next few years. So thank you so much for, again, practicalizing exactly what cultural competence is all about in this community-based preparatory research. Again, thank you. We'll keep in touch. We'll keep in touch, okay?
Yes, thank you. And thank you, Jorge. I can't see you on the screen, but thank you.
I just appreciate it. And I took the lessons of listening and everything by really just Googling CVPR BME. And you were the only person I found after 6 months of research. And so you picking up that phone to have like an hour conversation pretty much changed my perspective of grad school and everything that we do. So thank you so much.
That's so wonderful to hear. Thank you for saying that.
All right, Prof, do you want to take it over and introduce Dean Martin, or I'm happy to do it as well?
No, you just go ahead. You just go ahead.
Okay, so I think we are a little bit behind schedule, and we want to thank the Dean for his patience. But I don't think anybody here needs a formal introduction of Dean Martin, but you know, I think in terms of Strive, you know, we worked hard over the last 5 years to really have, you know, to develop our community and really have leadership embrace our community. And we were really pleased when Dean Martin last year came to our event and spoke to our community. And this year we have so many more people that have joined us, and we're really thrilled about that. And we hope that Dean Martin can just share a word of you know, where we hope to go in terms of cultural competency, incorporating that into what, you know, we want to achieve in the future into our curriculum. And I know he has some brilliant ideas on this, and so we're looking forward to hearing a short talk from him and to address our group of how we can move forward. So I think I have Dean Martin as a co-host, so you can share your slides with us if you have them available. There we go.
How did that work?
All right, we can see him, so you're all set.
Okay, thank you so much, Steve. And, you know, I did enjoy, you know, I caught about 30 minutes of Natalia's presentation, really inspiring work. And I can't think of a way to really epitomize what the topic of this talk is really intended to be about, this thing when we talk about cultural competency. If I had to distill down what she said, and if I had to define cultural competency, the simplest way I know how to do that is the ability to understand, really understand in a deep way, to empathize those who have had a different lived experience. It's simple as that. You don't need to walk in other shoes. You just need to know what those shoes look like. And it takes work. It takes skill set. Empathy is a skill set. And that's really what she was talking about. So cultural competency is the ability to understand those who've had a different lived experience, because there's nothing more impactful in our life than our own lived experience. It creates our frame of reference, and it really determines our perspective in the world, how objective we can be, how we perceive the world, what our frame of knowledge and understanding is, how we make decisions. And so that was an excellent example of that. And I feel cultural competency is really the goal we're after. Much of these discussions that we've had of late, we're talking about ideology, we're talking about social justice. I think one of the ways toward that is to have a greater sense of cultural competency, at least as an academic institution, focus on building platforms for upward social mobility. That's one of the greatest skills that we learn here. And so the talk here is really focused on some ideas that I just want to educate the population on. I want us all to sort of have a common framework of understanding, but really at the end tell you about 3 or 4 ideas related to cultural competency. So my talk is geared a little bit toward African American history, because I think it represents the greatest disparity in terms of social justice when we're talking about this cultural competency, in terms of comparing populations from majority and non-majority. And so it's a good topic to really frame our understanding of those who have had a different lived experience, and talk about higher education and what its role is. I'm assuming you folks can see these slides, okay? Is that correct? Okay, so let's go back and let's look at some history. And I want to show you a graphic here that sort of looks at one way to frame history of the African American experience, and one of the reasons our culture is different these days. If we look at African Americans, we would start with 4 different phases, particularly in the southern states, that we have to focus on. There's a period that I've characterized with slavery, beginning in the 17th century, ending in the 19th century. The second era was Jim Crow, which really started in after Reconstruction was over, which was 1877, up until the 1960s. So that was separate but equal. It really got exponential after 1899, Massey versus Ferguson, landmark Supreme Court case. And that was important for this disparity that really, after the Civil War, that really increased. Then there was a period I would call redlining, which is another type of segregation. Redlining is the practice of, it really started in 1934 with the Federal Housing Act, where home loans were determined based on areas of the city where you lived. And there were areas that were targeted as being higher risk, and individuals in those areas either couldn't get home loans or they were at subprime mortgages. And so redlining is a practice that's still apparent in many areas, but it was still very prolific until 1968, which was the Equal Housing Act. And then mass incarceration. And I want to show you some figures related to African Americans, predominantly in the southern states, about rates of incarceration. Okay, here's an example I just put in here for redlining in Pittsburgh. This is a map of Pittsburgh in 1934. You can see the rivers here, and this would be Point Park right here, where we had Fort Duquesne and Fort Pitt. But these areas in red, this was in 1934, the areas in red were areas of high risk. The areas in green are areas of lower risk. So mortgage lenders would use these types of maps to determine the suitability for loans. But it also determined which school you got into. It also determined what healthcare you had. So it was a form of place-based discrimination. So that's what redlining is. If I put it in the context of what we've seen recently and talked about some of the movements and the fights for social justice, the first era was the post-Civil War Reconstruction, 1870. Frederick Douglass was a big reason, worked very closely with President Abraham Lincoln to shape a lot of the policies that were going on during emancipation and Reconstruction. The 1870s up until about 1899, that was a very important time for African Americans. There was a Black innovation and Harlem Renaissance in the early 1900s. This is George Washington Carver, most prominent African American scientist of the 20th century. And that's a rich history of innovation there. And then, of course, we had the civil rights movement in the 1960s, 70s. And our university was a big part of that in the 1960s with what happened in the computer center. And that's really when things like Impact emerged, and lots of different movements were here at the University of Pittsburgh in the late 70s. We were a private institution at that time. It's when we became a public affiliated institution. It's when Carnegie and the Mellon Institute, which was University of Pittsburgh institution, merged. So there was a lot happening to shape social forces in the 70s. I'm a fairly young person still, but in South Carolina, they were so late in integrating that in the 70s, when I was in school, the first year I went to a segregated school. They didn't integrate until the 70s in South Carolina. And then, of course, we have contemporary examples with Black Lives Matter and George Floyd in 2020, which has shown the underbelly of some injustices that are still resonating. I wanted to give another sense of history. Some Black history in Pittsburgh. This is a sketch of Martin Delany, Major Martin Delany, who was an incredible hero. He was the only Black officer in the military forces during the Civil War. He was in the Union forces. He was from Pittsburgh. He was also a doctor. He went to Harvard Medical School, and he went to medical school in the 1850s. And he was a very influential person in the region. He was a very noted doctor and had lots of important work that he was doing here. He also spent some time in South Carolina. He ran for lieutenant governor. This is before the Civil War. In a runoff election, he lost lieutenant governor, but he was just an amazing person as an African American then. In the 1850s, going to Harvard Medical School, and then serving as the only field grade officer. He was a major in the armed forces. So if you go down to the PPC, the Market Square in Pittsburgh, right at the PPG building, the glass building, there's a big historical monument for Martin Delany. It's an incredible story, and he's written some amazing books and gives incredible insights about the importance of education. And he was talking about then, he went to Harvard Medical School, but he became a hero and to African Americans, and he wrote a lot about the importance to access to education. So I wish we had time to get into that, but if you look at some of his writings, they sound contemporary. He was writing this in 1852, one of his first books on the means of elevation of African Americans. And this was before the Civil War. It was so progressive. And you had some other really important prominent figures here in Pittsburgh. I won't go over all those. And our very own William Hunter Damon, who was a graduate from civil engineering in 1893, the first Black graduate of Pitt. He was a civil engineer. The railroad switching mechanisms that are used all over the world now are credit to him. Those were his patents and invention. That was 1893. And he died penniless in Allegheny County. He died penniless. He worked in Europe. He spent a lot of time in London. He was very prominent. He did well in his class, but he died penniless. And I've researched his life and history. The 1890s was a really important time. And those of you that have listened to the Juneteenth video, I talked about 1899 being the time where per capita, there were more African Americans patent disclosures in 1899 in the history of African Americans in this country. And we still have not gotten back to that era of invention, because that's when we had really legalized segregation started in 1899. So William Hunter Gainey was, William Hunter Gaiman was certainly one of ours and has contributed a lot to these movements. I'm going to talk about some social dynamics, and some of these slides are from our new vice president for diversity, vice provost for diversity, John Wallace. I just want to show some statistics too.
Hey, Martin,
Yeah.
I just want to interject real quick. So your voice is sometimes coming in slowly. We're wondering if you could just turn off your video, and that may help with the bandwidth to come through.
Okay.
That's perfect. It only happened a few times, but I think that'll help.
Okay. How's the fidelity now?
It was off and on, so we'll just have to go with it for now.
Okay. I want to talk a little bit about social dynamics. Just to understand social dynamics, to just look at numbers, and then we'll come back and talk about it. So here's the number. 13% of the population in the United States is actually 13.7% of the population in the United States is African American. 40% of the homeless population in the United States is African American. If we look at businesses, Americans make 12% of labor force. Actually, this is for all Black people, so it's more than just African Americans. So Black men and women make up 12% of the labor force. They own 2% of the businesses. So if we look at small business impacts during COVID, and so what we have here is a graph that shows workers who were displaced, the percentage of workers in businesses that were displaced during COVID based on race. And back in April, this is as of April, we can see about 18% of workers were displaced at that particular time, with small businesses that were white and Asian and Hispanic being over 30%, and Black were over 40%. So there's a disparity there, right? So this COVID disruption has been a little unequal. I also want to share African American income since 2000. So what I'm showing here are trends. It starts in 1996 and it ends in 2016, so that's a 20-year gap. But I want to look at 2000, and I want to look at kind of where we are now. So we've seen African Americans' income decline since 2000. In 2000, and these are inflation adjusted, right? 41,363 now, 39.490 is the average of the working class income. And relative to every other group, that's the only group that has declined in real dollars over the last 20 years, at least over 16 years here in this particular chart. So everything peaked in 2000, and then real income, inflation adjusted income has gone down, and it's actually lower for African Americans that it is, it's the only one that is lower than what it was before. And that is something we have to pay attention to. Let's look at higher education. What has higher education done? Okay, so this is a graph that is a ratio of what tuition costs, tuition and fees. Now, tuition and fees are one thing that's important. What's really important is the total cost of attendance. So total cost of attendance is proportional to what I'm going to show. But this is a timeline that shows a ratio of tuition, inflation adjusted tuition in 1990 relative to different time periods up into 2020. And so what it shows is how tuition has increased for public schools, public universities, for two-year schools, community college, and for private schools. And what this shows is over a 30-year period, the cost, the tuition and fee cost of public four-year institutions like the University of Pittsburgh, like Virginia Tech, like Penn State, public, it's about 300% increase, about 3 times inflation adjusted. These are all inflation adjusted, okay? Community college has also increased about 2 times. Private schools have increased about 200%. So public schools have certainly increased more. And of course, that is a in direct proportion to the amount of public dollars that has declined in terms of public support. It's also has a lot to do with the fact that higher education as an industry, which is you know, $100 billion industry, has increased expenses faster than any other segment of business. Another important stat here, this is a rate of, this is looking at college attainment for men and women. Women are shown here represented by the gray bars, the bluish gray bars, and the purplish lavender color bars are for men. These are educational attainment rates for different race groups. And you can see that on average, and this is over a 15-year period from 1996 to 2010, the trend would look the same if we extended it to 2020. But you can see here that over that 15-year period, for African-American men and women, the attainment, 6-year graduation rates. Now this is graduating with a bachelor's degree, right? Saying after 6 years who's graduated. That's been less than 50%, and it really hasn't increased, okay? But look at these other groups. They have shown steady increases. And we have to ask ourselves, why is that, right? And I've looked into this in great detail. I can tell you which states are doing a really good job. I can tell you which states aren't doing a good job, but there's a lot of information in this. But you can see that most of these areas we've seen increasing rates of attainment. And that's something that we really have to pay attention to. I wish we had time to talk about this for a long time, because there are some underlying social factors that are associated with this. So if we simply look at the same data in a different way, I'm showing here some educational attainment levels for white and some educational attainment for Black. And what I mean by white and Black, when I say Black, that means everyone of color that identify with Black. It means African nationals or nationalized, or people that are African Americans. It's the whole group of everyone that identifies with being Black. So it's very different than African Americans when I label this as Black. So this is a compilation of everyone that identifies as Black. So if we look at white, the things that we pay attention to are the post-secondary rates, the associate's degrees, the bachelor's degrees, and the advanced degrees. And so if we look at the associate 2-year degrees, it's about the same, actually a little bit lower for Black than white. But if we look at bachelor's degrees, and this is saying how many people, what percentage of the population has these degrees relative to others, you can see Black many times, well, 2/3 of what it is for whites. And in terms of advanced degrees, half the rate of what it is for white of the population by general. So we see there's a big disparity in terms of educational attainment in post-secondary degrees. And we saw from the graph that I showed earlier, the rates of attainment are not increasing and the graduation rates are not increasing. Let's talk about what that means in terms of wealth. So here's a plot of household wealth. This is average household wealth across the United States from 2013 for families with a college degree, broken down by white and Black. So if your family the wage earner, the head of household, has a college degree, the average wealth is about $181,000 for white families. That number for Black families is $23,400. Even if they both have college degrees, there's a big difference in wealth. That's for, this is for an undergraduate degree. Let's look at a graduate or a professional degree, master's degree, PhD, or some other type of professional degree. The median household income for white with advanced degrees with head of household is close to $300,000. And for Black families in the United States, around $85,000. So that's 3 times the difference here and 7 times the difference here. So even if there is advanced degrees, there's still a disparity here for some reason in terms of wealth. Okay. Those are some social dynamics that I wanted us to be aware of. And now I want to talk about the future. So let's pivot a little bit and talk about the future. Steve, is the video doing a little bit to help us a little bit with bandwidth?
It's still doing it just a touch, but it's definitely, I mean, you're coming through fine, at least on my end. You know, as far as I'm able to understand everything you're saying. Just every once in a while it just slows down and then speeds up. But it's I can interpret what you're saying.
Well, as Jeff Bifferman just said, I am in the heart of Appalachia, and so that probably has something to do with it. So I'm at the farm. So let's look at the workforce of the future. So if we look at the workforce, I want to talk about what's going to happen by 2050. Let's look at the current composition of the US population. So the current composition of the US population now is shown here. We have 62% white, which is a little over 200 million, 13.7% African American, 18% Hispanic, Asians 6.1, and then 1% for Hispanic and Latino. I'm sorry, 18% for Hispanic and Latino, 6% for Asian, and Native Americans as 1%, which is a part of my heritage. So that's a breakdown of the US population, okay? If we look at the workforce by 2050, the workforce, right now our workforce in the United States is 164 million. So what is it gonna look like in 2050? This is what we look like in 2020. The workforce in 2020. Now this is overall population. Here I want to talk about the workforce in 2050. This is 2020. In 2050, 46% of the working age population will be white, 14% African American, 29% Hispanic or Latino, and 10% Asian. So what we're going to see is this dramatic shift in the workforce, the demographics of the workforce, and the majority of the workforce, which will be 200 million by 2050, will be non-white. And the other thing that's important, 2/3 of those here in our workforce in the US, 2/3 of those will require some post-secondary education like a college degree, or some post-secondary education at least, whether it's a college degree in the sense that we have accreditation established now. That's really important for us to see. Our demographics are going to shift in 2050. We'll have a non-white majority. And so we got to look at where we are now and the work that we have to do to get the pipeline. So 2/3 of them are going to have a college degree. And so let's look at what we have now. So the current population with the post-secondary education broken down by race. So the employer demand, even in 2020, is 65%. Hispanic and Latino, so this is looking at the percent of workforce in 2020 with some post-secondary education. That means some post-secondary education. Doesn't mean completion of a degree. It means just some school. Hispanic and Latino have 37%, American Indians, Native Americans, 49%, Blacks and African Americans around 53%, and the white population about 64%. Now, what we're going to have to consistently be is above 2/3 of the population. So all of this area over here, all of this area here with all of these demographics here, all of these groups are going to have to be over at least 2/3 of those are going to have post-secondary education simply to meet the workforce demand of 2050. What I put here is something I've been studying here recently because I'm from the South and I look a lot at what happens in the southern states. And so I use Georgia as an example to talk about, well, why is this number so low? I mean, what's happening? And especially as we've had this ideology and unrest, I wanted to understand as many of these social dynamics behind it. So I put something here that I think is very instructive and something I'm very passionate about. So this would be the same for South Carolina or Alabama, Mississippi, Louisiana, Arkansas, any of those states. This is Georgia. So if we look in 2015, I've got a number that shows the percentage of the population of Georgia that's in jail in 2016. 32% of the population of Georgia is Black, but 51% of the jail population in Georgia is Black. If you look at prisons, which are separate data, longer term sentences, in 2017, I had data. Again, 32% of the state population is Black. 60% of the prison population in Georgia is Black. Remember, I was talking about that first slide when I was talking about mass incarceration. Most of these are nonviolent crime. Most of these are related to drug charges. And so this is where the students are, right? This is the path we're on. Now, I took an example because we're an engineering school and STEM degrees are in more demand than ever. So when we were talking about the skills that we're going to need in the economy of 2050, where 2/3 are going to have post-secondary education, much of that is going to have to be STEM-based. And that's where I'm really going. So then I started saying, okay, if this is the case for Georgia, how many students are in good engineering schools in the state of Georgia? Georgia is an interesting population. It's 11 million people in the state of Georgia. 32% are Black. The city of Atlanta is 55% African American. It represents a demographic very much like the future workforce would look like. And it's got one of the largest educational systems in the country. There are over 330,000 college-age students in the state of Georgia. By comparison, a state like Virginia has maybe 200,000, and Pennsylvania something close to 250,000. So Georgia, with over 300,000 students in the higher education system, but most of their Black citizens are in jail and their Black youths are in jail. So I asked the question, what is the population of the Black faculty at Georgia Tech? Does anybody hazard a guess at what that is? What the number is? The percentage of Black faculty at a place like Georgia Tech in the same state? Remember, Atlanta is 55% Black. Does anybody know about what the demographic is? Would you want to guess?
I'm saying 2%.
It's about 2.9%, right? In a city that's 55% Black. In terms of students, there are about 6.6% number of undergraduate students across the university that have access to education at a place like Georgia Tech. And I'm saying Georgia Tech because it's an AAU school focused on STEM. In terms of graduate students, how many graduate students across Georgia Tech are Black students? 3.8%. 60% of the prison population is Black. 32% of the state population is Black. 55% of Atlanta is Black. 3.8% of the graduate students are Black. Less than 3% of the faculty are Black. Less than 7% of the students are Black. So these are dynamics that we need to be aware of with higher education, and lots of implications. Again, I just chose Georgia because I happened to look at some statistics there, but I've done the same analysis for all of the southeastern states. So what cost does this mean? I mean, what does it mean for us? What are the opportunities for us if we close the gap? If we close the educational achievement gap and got education, especially STEM education, to the percentage of population that I just showed you that doesn't have it, if we bring everything up to where the white level of attainment is for these other groups, Hispanics, Blacks, the estimates are that that would create a GDP improvement gain of $8 trillion that would be added to our GDP, which is 1.5 times almost the GDP of Japan. For every dollar that we spend in early childhood education, which is key, there's a long-term return of $13. And so lots of communities across the country have started to really look at inclusionary residential zoning practices, which influences early childhood educational experiences. And it's kind of reversing the cycle of redlining. So lots of progressive communities are looking at that. And that's on the increase, but we're missing out on an $8 trillion economic opportunity. And so I just wanted to end by talking about what do I mean by cultural competency. And I started out talking about these things. I thought it was important to talk about where higher education is and sort of the challenges that led us to here. So when I say cultural competency, I've explained what it is, but the implications are things like, for admissions, we should look at other ways other than just ACT and SAT to look at students' ability to learn. And so this year, the University of Pittsburgh, including the School of Engineering, during this year with COVID will be SAT optional. So students that have ACT or SATs can submit those, but if they don't have them, they can still have their scores evaluated. The same considerations are being looked at for GRE. ACT and SAT are largely directly a function of affluence, not learning ability. They do indicate how ready students are to do well in our programs, but that's a different issue. It doesn't have to do with their ability to learn. This flex at Pitt model that we're embarking upon is really, this is something I want to work on too, and something I'm writing about. It really is designed to allow us to reach largely the same students that we're reaching in different geographic regions. It means that if students are not able to come to class, or if faculty aren't able to come to class, it's a mechanism that allows both sides to be able to adjust and be flexible. So it's to overcome geographic boundaries. What I am proposing, and I've talked to the provost about this, is that instead of just overcoming geographic boundaries, we also look at it as being flexible to overcome social barriers, because we are reaching largely the same students that we would have been reaching in the first place as we're approaching it now. We're just reaching them in a different geographic locations. My philosophy is that we use this flexibility to reach a different profile of student and reach them at a different point in their careers and engage them for a longer time. So it transcends what we do now as a 4-year college experience. We can reach different students, we can reach them earlier, and we can reach them long after they finish. So that flexibility is something that we really need to leverage, because the flex at Pitt model was developed in the School of Engineering. That really is where it was developed in the version that is being used. So what you engage is, I think we need to look at university more for lifelong learning. I think personalized lifelong learning. So really what I'm advocating and we'll be writing about is we need to shift our thoughts from higher education to higher learning. I like that term better, because now we're talking about this ability to continue to learn. I think these shifts mean we have to look beyond traditional higher education and look at higher learning, looking at platforms for lifelong engagement. And I envision a case where you can use things like artificial intelligence to design a unique experience for every single student before they get in, as they're here, and engage them for 20, 30 years over their entire career. And so what we're saying is, there are millions of different combinations of curricula or experiences for internships or experience or eligibility for fellowships and courses and online systems and job internships and co-op experiences. All those things, there are so many of those. I think an artificial intelligence system is what we need to really categorize all the different opportunities out there to allow people to really have this lifelong, individualized, personalized learning opportunity for their lifetime. And that's something that we can do that's quite unique. So it's looking at this lifetime of discovery, the slope of discovery that continues, which I've written about. I called it AQ, which I think is a better measure of this lifetime learning, is a better indication of impact rather than GPA, which does not correlate to overall lifelong achievement or attainment at all. It only correlates to the first 2 years of a graduate's experience. And the last thing I'll end with is I would like for us to establish, and I've been talking to our colleagues in psychology and sociology and also psychiatry, to look at a new cultural competency index that is a measure of our ability. It's a measure of empathy. It's a measure of the ability to be adept at understanding others. And it's an adaptability measure, because we see those that have a high level of empathy and intellectual curiosity and a growth mindset, just like Carol Dweck has talked about over at University of Pennsylvania in her book, Mindset. There's something different that forms, and that people that have a higher level of cultural competency also have growth mindsets as opposed to fixed mindsets. And so there are discussions about how to develop some index to measure and track behavior of cultural competency, all the way down to some sort of neurological shift and some signature in the brains of those that have higher levels of empathy. And so there's never been something that looks at behavior. And so this is a next level look at things as opposed to diversity training. This is something that's completely different and can be revolutionary. So let us lead some of that here. And those were the main points I wanted to cover.
Thank you very much, Dean Martin. That's awesome. I think your ability to dig into history and do analysis on kind of this broad data and then disseminate that to us is always so impressive, and I learned so much from it. So people have been asking some questions in the chat, and there's been some conversations. I know Halsey was interested in knowing about Pitt's specific numbers. I think it was early on when you were showing some of your data on how different institutions varied demographically. And basically, I think the trends for tuition on dollars. And I think she had some questions about, how do we fit into those numbers? And I think Paul provided some published data. I don't know if anybody had the chance to look into it, or if you know off the top of your head, Dean Martin. Yeah, go ahead.
Yeah, so I have those data as far as tuition and how we've trended. So the University of Pittsburgh has been on the higher end of increasing. If you look at over the last 35 years, we used to get about 35 to 40% of our operating budget came from the state. Now that's about 7%. So our tuition has increased more than 350% over the last 35 years here at the University of Pittsburgh. In terms of the one thing you have to look at, what I always do is look at the total cost of attendance over median income, median household income in the state. And that number for the University of Pittsburgh is about 50%, 51%. So we have median household income in Pennsylvania in the mid 60s, and the total cost of attendance at Pitt is in the mid 30s. So we're at about 51, 52%, and that's a pretty good number relative to other places. The high end that I've seen that figure be about 70%, and that is at some universities in South Carolina, in the southern states. You have schools that are very expensive relative to the total cost of attendance. And anytime the total cost of attendance relative to the median household income for a year is over 50%, you have reason to be concerned. In terms of demographics, Pitt has 8.1% African American students. Here in the College of Engineering, we're closer to 11 or 12%. Last year, the statistic, if we look at underrepresented minorities overall, we went from 11% underrepresented minorities in 2018. In 2019, we were at 18% underrepresented. So we made that shift. In terms of first-year students, first-generation students, we were at 5% first-generation students entering our freshman class in 2018. And in 2019, we went from 5% to 13% first-generation students. So we've got some good trends. We want to do better. We're not increasing the numbers of the diverse population as much as I'd like to see, but we certainly, given our status, and we're higher than the school, we're higher than the university and the College of Engineering, but given our location in Southwest Pennsylvania, I'm sorry, we're holding our own. But this cultural competency that I'm talking about is something that I want to have built into the curriculum. I want to have it built into everything we do, because part of our experience, remember what we said at the beginning, it's about the ability, the goal is the ability to understand the lived experiences of others, which means we have to work at that just like we integrate reading and writing and design in the experience that we have as engineers. We have a culminating design experience senior year. We do all those things and we certify that by ABET. I envision a curriculum where we also are certifying cultural competence. And so that means if we have people who are adept at being culturally competent to relate to, not just from different cultures. I didn't just specify cultures. I mentioned culture because I'm talking about culture here. Really what I'm talking about is identifying with the lived experiences of others. That's really what I'm saying. It's a broader definition. And we do that through, there's new data, there's new techniques, there are courses on professional presence and emotional intelligence. This is a type of emotional intelligence. So it's next level beyond diversity training. There are methods and means to do this. And we can integrate this into our entire curriculum. So that means that everyone that is a part of our program and everyone that graduates our program has the ability to have this discovery and opportunity here. Okay, so that means when that's measurable. Because otherwise, if you're in a place like Utah, you would be looking at diversity very different than if you were in a place like Alabama. You know, how you would say, we've achieved some diversity numbers, or we have achieved our diversity mission would be different. I think what the conversation that's missing is, we need more cultural competence. So that is a measuring stick that everybody can use as an equalizer. And I think that is the approach that I'm advocating. It's for everyone to integrate cultural competence into our curriculum, into the way we assess, we hire, we cultivate, we develop, the way we engage. And so then we become part of the solution, right? It gives us a very tangible goal. And we've just got to develop the right kind of index to measure it. We have IQ, we have things like GPA and SATs. We need an index that allows us to see our growth toward this cultural adeptness. I think that is the future, and I want us to be among the leaders to do that. I haven't heard anyone else talking about this approach.
So Jeff, did you want to ask your question, and then we'll go to Sanjeev and then Sarah and Papaya?
Sure. we're well aware of all the social justice issues that we face, but it seems like, you make a little progress and someone puts up another wall. And I keep trying to, every time I look at this, I keep going back to money and politics. I mean, it just seems like we have to address money in politics and make it a true democracy before we can really make long-term, effective, meaningful change. I didn't know if you had thoughts on that, and also, what we can do.
Yeah, I think it starts with awareness, and that's why I'm talking about cultural competence, because it starts a movement of awareness. And the biggest thing that we've come out of some of the disruption, I should say, COVID-19, the virus, and the ideological pandemics, the social justice, they are the same thing. They're not different. It's just manifestations of the same things. The communities that were most affected are the same communities that are talking about social justice. So let's look at those at the very same thing. I think you're absolutely right, Jeff. We have to have a wholesale shift in the power formula, and it starts with awareness. And so this cultural competency is a way to, first of all, cultivate what I call professional presence. Another word for that is the awareness to start to simply appreciate the lives of others. And there's some amazing books that have been written lately and some insights that have been made on this about how difficult and deceptive the problem is. Because I think a lot of what people are talking about with social justice oftentimes is cast in the framework of intentional discrimination or acts that really keep people out based on race and conscious decision. That's not where the issue is in the vast majority of cases. It is in systems and it is in cultures and frames of thinking that have taken away our ability to understand and be aware that these things are even present. So it is quite deceptive. And remember, there is a huge difference. When we talk about systemic racism, it is not about, and social justice, it is not about an individual. It is not about a collection of great individuals that mean well. It is about a system that we're all part of that make it difficult for us to really get out of the box and understand that the lived experiences are tremendously impactful in what we see every day. So I think it starts with awareness, which is why if we start to develop a system where all of our students and all of our faculty and all of our staff and the way we do everything we do, we start to this movement of increasing our level of awareness and understanding, I think that in itself is a more powerful approach. In addition to sheer numbers. I mean, it's great to have numbers that increase. We want to have a number that looks more like the workforce we're going to have to build. And this is an economic imperative. We want to talk about the biggest threat to national security of the United States. I can tell you what that is. You know what that is? Becoming the #2 superpower. That's what that is. The biggest threat to our national security is not having the total economic output of China. That's it. And so how do you get that? You add to your GDP. Right now, our GDP per capita is $80,000. China's is around 11, okay? So the biggest threat, whoever has the biggest total economic output, they've got 1.4 billion people in China, 1.4 billion. And think about what it means if they simply increase GDP per capita. Their economy would double overnight. And where would we be? So security in the world comes down to who has the largest overall economic output. And so after that, it really doesn't matter. History shows that if you have the largest economy, you are the big dog on the block when it comes to national security. So this is a national security imperative that we do more to reach those segments of society to get that additional GDP and to keep going from there. So it's the awareness that we need to raise, and Jeff, you're right, unless we understand institutions and the history of things like what we just talked about. You look at Georgia, I mean, really? You want to know why we've got issues there in Georgia? Because we pay for that. We pay for those barriers in other ways. We pay for it in healthcare costs. We pay for it in security. We pay for it in taxes. Georgia Tech is sitting right in the middle of Atlanta, 55% African American. 60% of the population is Black in Georgia, prison population. The students that are studying engineering, getting an advanced degree, 3.8%, do the math. And so that's gonna catch up to us. So it's not about, and I wanna also emphasize, Jeff, this is a long answer, something I'm very passionate about. What I'm talking about is not, I simply used African Americans because of the history of culture in this country. I want to talk about African Americans as opposed to Blacks, mainly African Americans, and compare that to the majority population because it represents, again, the greatest disparity. I want to make very clear, what I'm talking about is not for one, I'm not talking about raising up one group or other groups to others. I'm talking about growing everything for everybody. So what I'm talking about is cultural competence. I'm talking about adding to GDP. I'm not sitting here talking about let's right a wrong that's never been corrected. Yeah, we need to do some of that, but I'm talking about something much broader and inspirational than that. Every student that we recruit, every faculty member that we recruit, we need to have a reason why they're coming to join us. It's not just the students that are underrepresented. This is for everybody. We got to have reasons why everybody wants to be a part of the University of Pittsburgh. So this is a message for all of us. I'm saying, how do we move together forward as a country? We increase GDP, that helps everybody, right? So I want to make sure that this is not something that I'm talking about to bring us up somewhere. This is about how we actually grow beyond, right? Part of which we got to do is to look at why we are, but I'm talking about going a whole different place.
Okay, so I'm going to try to summarize a few of these questions. It seems like a number of people are interested in how we can use kind of this new model to reach additional individuals, like, you know, lower income, people in prisons, for example, to, you know, Lance brought that up to follow up on what Angela Davis suggested at the Diversity Forum, and what kind of resources are going to be needed to make those types of things happen. I think that summarizes at least 3 or 4 questions. You know, I just, in the interest of time, I'm just trying to hit on.
How are we going to use the Flex at Pitt model to reach a different demographic?
Right, exactly. Or,
yeah,
you know, increase upward mobility, and what kind of resources are we going to need to increase our cultural competency moving forward?
So I can answer the second part. So I've requested a proposal for people who are experts in this, on the leading edge of this. One is from Iowa State University, another is from Atlanta as a private consultant, to talk about how we actually build cultural competence into a curriculum. And there are those that have been working on that. And I don't think there's a lot of resources there, other than the fact that we start with a framework of understanding and figure out how to do it. But there is some novel research that we're discussing with psychiatry and psychology about groundbreaking work that we want to propose to actually start to study how behavior changes before and after different kinds of experiences. And there are those that are just tremendously qualified to do that work. It's exciting. We talk about once a month on this since the pandemic, and those are next door in psychology and also in psychiatry. And so we're developing a proposal on that, hopefully, that will go to NIH. The main question, though, is how do we do it? I don't know how we do it yet. We're going to have some corporate sector involvement as well, because they care about this even more than we do, because they're a little bit ahead of where we are, because they're multinational. Many of them are working in areas where They have to have a much more diversified workforce to be competitive. And so part of it is partnership with them, but it would involve recognizing what everything is based on this trajectory of growth. The theory behind this cultural competence and this increased learning has to do with, and how we would use the Flex at Pitt model, is that studies have shown that if students have an avenue for growth and it's personalized and that can go at their own pace, they go from about 35 to 40% attainment up to almost 90% attainment. And they've shown this with inner city schools in Chicago, LA. There have been some studies in Asia. There's been some studies, well, in Japan. There have been some studies in India as well, in Asia. And so what we look at are indications of continued growth. So that means that in our traditional vernacular, we're looking at if a student has a 2.4 and then a 2.6 and then a 2.8 and a 3.0 with a high level of social engagement, if you do the statistics, you'll see if that continued growth, that continues for an entire lifetime. It doesn't stop. And there is a correlation between that and overall career attainment and success. What we don't see is a correlation between students that have high levels of achievement in school, like a really high GPA from a really top school, with lower levels of social engagement. There is no correlation that shows that is a benefit beyond year 2 or 3. So clearly there are many studies, Carol Dweck again at University of Pennsylvania, on this growth mindset. So the question is, how do you recognize grit? How do you recognize this growth? How do you actually encourage it? It means that we're going to have to have a lot more sophistication in individualized experience, which means that you're going to have a lot more hands-on support for students that learn at different rates. You're going to have individualized learning experiences that are different. So there are going to have to be some resources there. But we're going to start to look at students and use indications other than just SAT and ACT as indication of students' ability to grow, whether they're on this trajectory. And then we're going to continue that as they leave. So it won't just be a 4 to 6 year experience. It'll be a lifetime of growth, because we want to be the platform that people reach back to. And to be able to do all of that, we feel that you have to have an artificial intelligence system to serve as the super advisor, if you will. And we'll have to learn how to do it, but it's the epitome of personalized education. And so part of that starts this year with the incoming class of 2021. ACT and SAT will be optional for the University of Pittsburgh in the School of Engineering, the School of Business, and the Dietrich School. And so we're starting to look at how you recognize students with growth potential. And we're going to have to learn how to do that. And there's a lot of work that we're going to have to use. But GPA is an important factor, but it's the slope that's important. So I'm excited about it. I know there's a lot of work here because there's something for everybody. And it's about this continuum of growth over a lifetime.
So there's so many questions in the chat. Unfortunately, I don't think we'll have time to get to all of them. I want to just thank Dean Martin for dedicating his time. If you can stick around, Dean Martin, and maybe respond to a couple of those comments in the chat, that would be helpful. I just want to be respectful of everybody's time here, and we're already a little bit over, but thank you so much for imparting the wisdom, the history, the analysis of data, I think, and having this much broader 35,000 foot view. I think a lot of us are focused very, very much on at the individual level, and to have leadership focusing on the 35,000 foot view and where we're going collectively, I think is incredibly important. So thank you for your time. We appreciate everything you're doing for the school, especially in these difficult times. So if we could just help me blow up the chat and just say thank you to Dean Martin for stopping by. I appreciate that.
Let me also join Steve to thank you so very much, Dean Martin. It's kind of very exciting that that in the Strive program that we are thinking in line with what you are thinking, that and also in the Office of Diversity, we really do want to focus on this idea of cultural competence. And at least, and so that is what we believe that can make the kind of change, that can move the kind of change that we want to a sustainable level. So it is very, very exciting to hear your take on that, to also see that you are going in that direction. So this is the first time I'm really hearing in details of our alignment with what we're doing, with what you are thinking. So this is very, very good for us. So again, thank you so much, and we appreciate you so very much on this.
I did have one closing comment. I wanted to say thank you all for what you're doing. It's the work of our lifetime, and it's our purpose here is to create platforms for upward social mobility. That is our job, and that's for everyone. And so I always learn every time we engage. And the last things that I would say is that these crises have crystallized my vision and sense of purpose about the hard work we have to do to create these true platforms of upward social mobility. So it's certainly accelerated my vision for what it is that we need to do to make it ours. It's not about me. This is about something larger than me. And if we're going to drive change, which is what social mobility is about, right? Everybody wants to talk about driving change. Everybody wants to talk about having a next generation leader. Every university, you have those 30-second clips at the end of the commercial that talks about game changers and what they do and what we believe. And we have those commercials too. So everybody kind of wants to do that. Not everyone wants to do that when it comes down to doing it, right? Because there's a lot of hard work. It's a slog. And this crisis has really accelerated that. So we've got a lot of work to do, but these visions have been crystallized by the real work we have to do. So this school right now is focused on the things that are important and that make a difference. And we're going to go there together. And to drive change, you have to have cultural competency. You have to understand the lived experiences of others. Everyone has to understand the lived experience to others to be effective at driving change. And that's the central message. And that's why this work is so important for us to do. So I certainly appreciate it. And it's always good to be invited. And if you can send me some of these questions later, I'll be glad to address them.
Sure, we will have a copy of the transcripts, and so we can send those to you, certainly.
All right. Have a good meeting.
Yeah, thank you so much.
You bet.
So with the last kind of remaining time, I realize we're over time, but we want to definitely let you know how you can continue to participate in this kind of work moving forward. And for that, I'm going to introduce Melissa Billick, who's just going to talk briefly about what faculty and now students can do to continue to engage and have these conversations throughout the year. Melissa has been just a tremendous leader in developing what we call a learning community for just individuals to get together and have discussions on topics such as these, and to just share and learn from one another. And it's been a great space to have these conversations, and she's just created a great program, and it's growing. And so we want to capitalize on that momentum and encourage others to participate. So Melissa, I'm going to turn it over to you.
Thank you, Steve. And I'm very mindful that we're over on time. I had a half an hour, and I texted Steve this morning and said I'd have 15 minutes, and now I said I'll have 2 minutes. So, but I don't want us to lose the momentum. The one thing that I did want to point out is that one of the primary goals of the Pitch Strive program is to develop a shared vision. And that's, with the faculty, with administration, and with the students. And one way that we hope to do that is through a learning community. And without kind of belaboring and everything, we piloted our learning community last year. This is one of the meetings that we had. Unfortunately, I think COVID did have an impact on that. and we focused our theme on inclusion in the classroom. And so we explored different aspects of inclusion in the classroom. And the other thing that we've been doing is working in the Basecamp platform, where we've been posting different messages and different information. And although not explicitly a part of the learning community, one of the great outcomes was with Catherine leading the book club, which has been really, really awesome. And we hope to continue that in the fall. So long story short, we hope that you will join the learning community. We've expanded it as of today. It was like the unveiling to our graduate students as well. And I've sent all graduate students that were on Susan's list an invitation to the Basecamp site. And we will be having regular meetings. I think the first one after August is the first Friday in September. And so please consider joining and spreading the word. The more the merrier. So Steve, that was under 3 minutes.
That was awesome. But I really highly encourage you to participate in this group. It's a really nice, diverse, and open group, and just willing to learn from each other and share, and creates a really nice space for dialogue. And so I've benefited tremendously from this group, and faculty continue to participate on their own, on their own, and that I think tells you that those that have participated really found value in it, and they want to continue to see it going. So I encourage anybody who's interested to also participate, because I think you'll also find value in it. All right, so I'm going to turn it over to Dean Wusu in just a second, but I want to say this is the end here, and we want to thank all of you for participating, especially coming over, especially since we've been over time here. It's been a great event for us to do virtually. I think it's a difficult thing to pull off, to try to build community when we're all physically distant from one another. But I do see our community coming together, and it's a wonderful thing. And I think engaging in these discussions and developing cultural competency with one another is going to be the way our school moves forward. And so I'm really pleased to see all the participation, especially from those that haven't participated in this program in the past. I personally just want to thank Susan so much for all her work that she's put into this. She is just heart and soul of Strive. And I think, you see a lot of the students and the faculty who've been involved in Strive showing their applause, because they all know what she does for this program, and we thank her. And I want to thank Jorge because he turned us on to Natalia, and she delivered a dynamic presentation today. And we want to thank Natalia and Mikhail for their participation. And finally, I want to thank Dean Martin, obviously, for, again, continuing to support the Strive program and continuing to educate us about where we're going in the future. And finally, Michael Eatman, he is our guiding light, and I do consider him really part of our family, and really doing great things for our school. And we can't say enough good things about what Michael has done for us, and appreciate him. So, and then lastly, I want to thank my partner in crime, Dean Wusu, and all his efforts to put into this program. And I'm going to turn it over to him.
So much, my very, very great partner and friend. You've done a very good job. As always, we thank you. We appreciate you for what you do. I have always told the school that we want more Steve Abramowitz in the School of Engineering. And I'm pretty sure that anybody who has participated for these 2 days will agree with me why that has been my dream. So I do want to thank you, my friend. You've been a very, very, very great resource. I just couldn't do it without you. And of course, two of us couldn't do it without Susan. She is exactly the brain. She supervises us and in trying to follow up. So Susan, we appreciate you so very much. And my colleagues, I thank you so much. The community that Strive has built could not be a community without you. Students and faculty, we appreciate you. And we really want to listen to you. Like I said, we lead the program by listening, by communicating. And so we take that very, very seriously. So we challenge you to please let us hear from you. Anything that you want us to change, please let us hear from you. The Office of Diversity, of course, we are moving into, we've been thinking about a shift, and that shift is in cultural competence. We are going to be running a lot of workshops on those 5 areas. So please stay tuned, stay connected with us. Let us hear from you. So please, there is an evaluation going to be coming to you. So one way that you can help us is to fill that evaluation instrument, give us feedback. By the way, a lot of the changes that we have made in this program came from you. And so please feel free to give us that feedback and stay connected with this community. This is the time that we have to connect to each other, because we need a lot of ideas. We are going to be unveiling a lot of couple of new programs around the area of these cultural competencies. So your engagement is very, very important to us. And so with that, let's remain adjourned until next year again. And so we thank you. We thank the Dean. We thank Natalia. We thank Michael and Michael for making it a wonderful, wonderful workshop. Thank you so much. Thank you.
Thank you all.
Thank you.
Yeah, and I just wanted to, on behalf of the Strive family, specifically thank Steve and Dean Wosu for all that you've done. Thank you so much.
Yeah.
Thank you, Marissa. Thank you for directing this learning community. You know, I get excited about that program. Your leadership. We thank you so much. And thanks everybody. And you all remain very, very blessed and safe. Yeah.
Also, nice shirt, Dr. Wosu.
Oh yeah, I share. That's good. I saw the bright color. I said, okay, at least somebody picked up his like I picked up mine. Thank you.
Oh, I've been waiting to make a comment the entire retreat.
Thank you, Alvaro.
Thank you. Have a good one.
Okay. Susan and Steve, can you stay on the line, please, for just a few minutes?
Yeah, so thanks again, Susan, Dimboso, and Steve. I will follow up with Susan asking for the numbers, because actually I am under I was told that the ones that are published in the fact book are not accurate. So if I reach out to you, Susan, about it?
Yeah, they are not accurate. They are not accurate. But
I will just get to the diversity office and get the actual numbers from you. I basically want to generate the same figure of the last, like the evolution of the last 5 years. Is that okay?
Right. Just let us know. We'll see what we can do.
Thank you so much. I appreciate it.
Thank you, no problem. Okay.
Thank you.
Bye-bye.
Bye-bye.
Doc, I know you just called for the big wigs. You didn't call for me. I just wanted to just say thanks for letting me join y'all this week.
Oh yeah. Oh. I didn't even know you came back. That is so good to.
How did your meeting go?
It went really well. We have some we're recording still, so maybe.
Yeah.